So we've talked about different segments of the population, but there's one we haven't touched on yet, and that's income disparity. Mr. Blumberg? Mr. Blumberg, I should say. Forgive me.
That's okay.
Could you explain that to me, income disparity?
Well, you have, there's assumptions about access to health care with varying levels of income, and folks who are insured versus uninsured. And that's really how we sort of view the world and bringing resources to people, is about the payer groups they end up migrating to. Insured folks, Medicare, folks who are in Medicare, folks who are in Medicaid, folks who are uninsured. Mm-hmm. It should be no surprise that it's easier to build resources around patients who have coverage. But because we are a community asset, a nonprofit system, we try to build out ecosystems around delivery of care at all levels of health coverage in the community. It's a uniquely American problem.
Of course, yes it is.
Because we have such different kinds of coverage available to folks. And depending on the conditions that people show up with, create the mix of resources we can bring to the table. Thankfully, we have a lot of community partners that we do partner with to deliver care for varying groups.